Health officials and virologists continue to monitor a group of pathogens known as hantaviruses, which remain a significant concern for public health due to their high mortality rate and the speed at which they can incapacitate otherwise healthy individuals. In the Americas, the primary concern is Hantavirus Pulmonary Syndrome, or HPS, a severe and sometimes fatal respiratory disease. The condition is often described by the alarming speed of its progression, where a patient's lungs effectively fill with fluid, leading to acute respiratory distress. Unlike many other viral infections that primarily target the very young or the elderly, HPS is notable for its impact on healthy, active adults. This specific demographic focus creates a significant challenge for healthcare systems, as the onset of symptoms can be sudden and catastrophic. The virus belongs to the Orthohantavirus genus, and while it is relatively rare, its presence in the environment demands constant vigilance from surveillance agencies. The primary transmission route is through zoonotic spillover, meaning the virus moves from animals to humans. Specifically, various species of rodents, such as the deer mouse in North America or the long-tailed pygmy rice rat in South America, serve as the natural reservoirs. These animals carry the virus without becoming ill themselves, shedding it in their urine, droppings, and saliva. The risk to humans arises when these waste products are disturbed, causing the virus to become aerosolized. Inhaling these microscopic particles, often in confined or poorly ventilated spaces like sheds, cabins, or storage units, is the most common way people become infected. Because the virus does not typically spread from person to person in North America, public health reporting focuses heavily on environmental exposure and the ecological factors that lead to rodent population surges. The lungs on fire metaphor, often used to describe the condition, refers to the intense inflammatory response triggered by the body's immune system. As the virus targets the endothelial cells lining the blood vessels in the lungs, the capillaries begin to leak. This leads to a rapid accumulation of pulmonary edema, which effectively prevents the exchange of oxygen. Within a matter of hours, a patient who initially felt like they were coming down with a common flu can find themselves in critical condition. This rapid deterioration is why HPS is categorized as a high-consequence pathogen, requiring immediate reporting to state and national health authorities whenever a case is suspected. Understanding the biology of this transmission and the specific risks associated with rodent-heavy environments is the first line of defense in managing what remains one of the most lethal respiratory infections in the modern medical landscape. The clinical development of Hantavirus Pulmonary Syndrome presents a harrowing challenge for medical professionals, as the early stages of the disease are notoriously difficult to distinguish from common seasonal illnesses. Agencies like the Centers for Disease Control and Prevention and various international health ministries note that the incubation period can range from 1 to 8 weeks after exposure. During the initial prodromal phase, patients typically report fever, severe muscle aches, particularly in the large muscle groups like the thighs, hips, and back, and fatigue. Some may also experience headaches, dizziness, and gastrointestinal issues such as nausea or abdominal pain. However, it is the abrupt shift to the cardiopulmonary phase that defines the severity of the illness. This transition is marked by a sudden onset of shortness of breath and a productive cough as the lungs begin to fill with fluid. In clinical settings, doctors often find themselves in a race against time. Because there is currently no specific FDA-approved antiviral treatment, vaccine, or cure for hantavirus infection, medical intervention is largely limited to supportive care. This is the basis for the observation that doctors are often powerless against the direct viral mechanism. They cannot neutralize the virus itself and must instead focus on keeping the patient alive while the body attempts to fight the infection. In severe cases, this requires admission to an intensive care unit and the use of mechanical ventilation or extracorporeal membrane oxygenation, also known as ECMO. This advanced technology acts as an external heart and lung, oxygenating the blood outside the body to allow the patient's own lungs a chance to recover from the massive inflammatory insult. Laboratory testing is a critical component of the public health response, but it can be a bottleneck in rural areas where the virus is most prevalent, confirmation of a hantavirus infection requires specialized blood tests to detect the presence of hantavirus-specific antibodies, typically IgM or IgG, or the use of polymerase chain reaction or PCR to identify the viral RNA itself. These tests are often performed at state public health labs or federal facilities, meaning that local clinicians must maintain a high index of suspicion based on the patient's history of potential rodent exposure. If a patient presents with rapidly progressing respiratory failure and a history of cleaning out an old barn or cabin, medical teams must act immediately before the lab results even return. Public health reporting also tracks the geographical distribution of cases to identify emerging hotspots. While the Sin Nombre strain is the most famous in the United States, other strains such as the Andes virus in South America have shown a limited capacity for person-to-person transmission, which adds another layer of complexity to global surveillance and hospital isolation protocols. Prevention and environmental management remain the most effective tools in the global effort to reduce the impact of hantaviruses. Public health guidance is clear. The most significant risk factor is the presence of rodents in and around human dwellings. To mitigate this risk, officials recommend a strategy of rodent-proofing homes and workspaces. This involves sealing even the smallest gaps or holes in foundations and walls, using metal flashing or cement to prevent entry. Furthermore, removing food sources and nesting materials is essential for discouraging rodent populations from establishing themselves near human activity. When it comes to cleaning areas where rodents have been present, the guidance is specific to prevent the very aerosolization that leads to infection. One must never sweep or vacuum droppings, as this can kick the viral particles into the air. Instead, the area should be thoroughly soaked with a disinfectant, such as a solution of 1 part bleach to 9 parts water. After letting the disinfectant sit for 5 minutes, the waste can be wiped up with paper towels and disposed of in sealed bags. Wearing gloves and, in high-risk situations, a high-efficiency particulate air, or HEPA, filtered respirator is strongly advised for anyone performing these tasks. Despite these clear guidelines, there are significant limits to our current knowledge. Scientists are still investigating why certain people develop a more severe immune response than others, and why some years see a massive masting event where an abundance of environmental food leads to a population explosion of rodent carriers. Climate change and shifting weather patterns are also thought to play a role in the changing geography of hantavirus cases, as warmer winters or increased rainfall can alter the habitats of the host species. Surveillance remains a constant, labor-intensive effort, involving the trapping and testing of rodents in the wild to gauge the prevalence of the virus in any given region. As we move forward, the focus remains on early detection and public education. While the medical community continues to seek more effective treatments, the current reality is that avoidance of the source is the only guaranteed way to stay safe. Health officials urge anyone who develops a sudden fever or difficulty breathing after being in a rodent-prone area to seek medical attention immediately, and to explicitly mention the potential for hantavirus exposure to their healthcare provider. This transparency in communication can be the difference between life and death in a clinical setting. For more updates on global public health reporting and emerging viral threats, consider subscribing to this channel. The clinical progression of Hantavirus Pulmonary Syndrome, or HPS, represents one of the most significant diagnostic challenges for modern medical agencies and frontline healthcare providers. According to protocols established by organizations such as the Centers for Disease Control and Prevention, the disease typically manifests in 2 distinct stages, and the transition between them is often described as both rapid and devastating. During the initial prodromal phase, which can last between 1 and 7 days, patients present with non-specific symptoms that frequently mimic common viral infections, such as influenza or even COVID-19. These early indicators include persistent fever, intense fatigue, and severe muscle aches, particularly in the large muscle groups of the thighs, hips, and back. Clinical data suggests that roughly half of all patients also experience secondary symptoms such as headaches, dizziness, chills, and gastrointestinal issues, including nausea, vomiting, or abdominal pain. Because these symptoms are generic, many cases go unrecognized during this critical early window, leading to delays in hospitalization. The situation becomes critical during the second stage, known as the cardiopulmonary phase. This shift is characterized by the sudden onset of shortness of breath and a persistent cough, as the lungs begin to fill with fluid. This is not the result of a typical bacterial pneumonia, but rather a direct consequence of the virus attacking the endothelial cells that line the blood vessels. This attack causes the capillaries to leak plasma into the alveolar spaces of the lungs, effectively drowning the patient from the inside. From a clinical perspective, the phrase "doctors are powerless" refers to the absence of a direct cure or specific antiviral medication approved to neutralize the virus once the pulmonary phase has begun. While ribavirin has been tested in clinical trials, it has not shown significant efficacy in treating the pulmonary form of the disease. Therefore, the medical response is restricted to aggressive supportive care. This typically involves immediate admission to an intensive care unit where patients are placed on high-flow oxygen or mechanical ventilation. In advanced cases where the lungs can no longer facilitate gas exchange even with a ventilator, medical teams may deploy extracorporeal membrane oxygenation, or ECMO. This specialized equipment functions as an external heart and lung system, pumping blood out of the body, removing carbon dioxide, and infusing it with oxygen before returning it to the patient. While ECMO can significantly improve survival rates, it is a resource-intensive procedure available only at major regional trauma centers, creating a logistical hurdle for patients in rural areas where rodent exposure is most common. Laboratory diagnostics play a vital role in identifying these cases, though the process is time-sensitive. Confirmation of HPS is usually achieved through serologic testing to detect hantavirus-specific IgM and IgG antibodies. Public health laboratories also utilize polymerase chain reaction, or PCR, to identify viral RNA in the patient's blood or tissue samples. Additionally, clinicians look for specific biological markers, such as a low platelet count, known as thrombocytopenia, and an elevated hematocrit level, which indicates that plasma is leaking out of the blood vessels and concentrating the red blood cells. These diagnostic clues are essential for epidemiologists who track the virus's movement across different regions and seasons. While the media may focus on the high mortality rate, which remains approximately 38% in the United States, official health reports emphasize that survival is possible through early recognition and rapid transfer to facilities capable of providing advanced respiratory support. The mystery for many researchers remains the healthy adult factor. Unlike many pathogens that prey on the immunocompromised, the most severe hantavirus cases often occur in individuals with robust immune systems, leading some scientists to believe that the body's own overactive inflammatory response may contribute to the severity of the lung damage. Prevention and environmental management remain the primary pillars of public health strategies worldwide, as the lack of a specific vaccine or curative treatment places the burden of safety on proactive risk reduction. Health departments and environmental agencies consistently emphasize that the most effective way to prevent hantavirus infection is through the rigorous control of rodent populations in and around human habitations. This process, often referred to as rodent-proofing, involves a multi-tiered approach to home maintenance and sanitation. Experts recommend sealing any openings in structures that are 1/4 of an inch or larger, using durable materials such as steel wool, metal flashing, or cement, as mice can squeeze through incredibly small gaps. Beyond physical barriers, the elimination of food sources is critical. This includes storing pet food in rodent-proof containers, keeping trash bins tightly sealed, and removing brush or wood piles from the immediate vicinity of the home to reduce nesting sites. For individuals tasked with cleaning areas that have been dormant, such as cabins, sheds, or storage units, the protocol is strictly defined to prevent the aerosolization of the virus. Public health officials warn never to use a vacuum or a broom, as these methods can propel viral particles into the air where they are easily inhaled. Instead, the area must be thoroughly saturated with a disinfectant, most commonly a solution of 1 part household bleach to 9 parts water. After a soaking period of at least 5 minutes, The materials should be wiped up with paper towels or rags and disposed of in sealed plastic bags. Personal protective equipment, including rubber gloves and, in high-risk or poorly ventilated scenarios, N95 respirators, is considered a standard safety requirement. From a surveillance perspective, national health agencies continue to monitor the ecological factors that drive outbreaks. This includes tracking masting events, where an abundance of rainfall leads to a surge in seeds and vegetation, subsequently causing a spike in the rodent population. However, significant gaps in scientific knowledge remain. Researchers are still investigating the precise immunological mechanisms that cause the virus to be so lethal in healthy adults while leaving the rodent reservoirs asymptomatic. There is also ongoing debate regarding the impact of climate change on the geographical range of host species, which may bring the virus into regions where it was previously undocumented. The ethical reporting of these cases requires a balance between providing urgent safety information and avoiding the creation of undue panic. While the mortality rate is high, the overall incidence of the disease remains low, and infection is entirely preventable with proper environmental hygiene. Public health is a shared responsibility. Reporting rodent infestations to local authorities and staying informed about regional risks are essential components of community safety. As surveillance techniques improve and laboratory turnaround times decrease, the goal remains the same: to move from reactive treatment to proactive prevention. For continued coverage of emerging health threats and updates on global surveillance efforts, consider subscribing to this channel.